For the first time since the pandemic began, coronavirus cases have dropped in all 50 states. This comes as President Biden announced Monday that nearly 60% of adults in the U.S. have received at least one dose of the vaccine. But despite CDC guidance, many Americans are still questioning whether it is safe to take off their masks. Meg Oliver has the latest.
Tonight, with more people getting vaccinated and the number of new COVID cases down sharply over the last month, at least 25 states are adopting the new CDC guidelines and dropping mask mandates for the fully vaccinated. Some right away, and others, like Massachusetts, waiting a few more weeks. 2 states, New Jersey and Hawaii, will still require masks indoors indefinitely. No masks are required in Pennsylvania, except in Philadelphia.
Right now, the data, the science shows us that it is safe for vaccinated people to take off their masks.
But the largest nurses union disagrees and is calling for a reversal. And now there's not only confusion over what the rules are, but how to enforce them.
There's no way for retail food workers to determine when somebody walks into a retail operation whether or not somebody has been vaccinated.
And why aren't you letting me in?
This video filmed by former child actor Ricky Schroeder is one example. He tried to enter a California Costco with no mask.
I'm getting my refund from Costco.
California still has a mask mandate in place until June 15th, even though other Costcos have dropped the mask policy in states where it's not required.
I think everyone's going to lie just so they don't have to put it on.
Dr. Ashish Jha says he agrees with the CDC lifting the outdoor mandate, but it's too soon to lift the indoor one.
Outdoor mask mandates make 0 sense at this point. So it's really about indoor settings, and it's really about the next few weeks.
Target kept the mask mandate in place until they reviewed the updated CDC guidance. Now it's the latest big box store to announce they won't require masks for fully vaccinated customers or staff. As far as enforcement, they're relying on the honor system. Elaine?
Meg Oliver, thank you. For more on this, let's bring in Dr. Jessica Shepard. She's the Chief Medical Officer of Verywell Health, a website where medical professionals can provide health and wellness information. Dr. Shepard, thanks very much for joining us. As we heard, there's debate over the CDC's mask guidelines. As Meg Oliver reported, the nation's largest nurses union says these guidelines threaten frontline workers. What are your thoughts?
You know, these are the times that we really have to look at the chaos and confusion that these guidelines can bring for people who are worried about if they will be around people who are not vaccinated and still not wearing their masks. These are the questions that are concerning. However, CDC made these recommendations based on statistics. However, if you saw previously, it really has to do more so with indoor than outdoor and what that really means. Now, hearing what the Nurses Association said, I do believe that there is going to be somewhat of questioning from the public when they go into certain instances and establishments that still require the mask to be worn. However, with the new CDC recommendations, that can pose some questions and difficulties and what those communications and conversations can mean.
So nearly 60% of adults in the U.S. have had at least one dose of a vaccine. Remind us, though, Doctor, where do we need to be in order to achieve herd immunity?
Absolutely. When we think of herd immunity, absolutely, we want that level to be much higher, much more in the 70s to 80% to see that herd immunity where we're going to be protective for the community and making sure that we don't have the virus and spreading it to a number where we're going to see fatalities.
Well, how concerned are medical experts about a possible vaccination plateau?
Well, we actually are seeing these plateaus. If you look at the numbers from a recent survey that is looking at that was as much as how people think about the vaccination and thinking that most Americans are vaccinated when in fact they are not. So looking at those numbers, you again have hesitancy. You have people who do think that they should not have to have the vaccine because most people have. But what you're finding is that we are having a plateau. If you look at the numbers, especially of distribution, that has dropped significantly from the previous weeks that we saw in April and early May. So again, as we're seeing, more people are not really thinking that the vaccine is needed. But if you look at the numbers and what Biden, again, stated that he wanted that herd immunity to be reached by July 4th, we're finding that if we stay at the rate that we're going with distribution of the vaccine, we're not going to get necessarily to that herd immunity by July 4th, and more likely maybe more into the months of November.
Meantime, President Biden will be sending 20 million Moderna, Pfizer, and Johnson & Johnson vaccines abroad by the end of June. That's in addition to 60 million AstraZeneca vaccines waiting to be approved by the FDA. How much of an impact could this have on other countries who are still struggling to contain the virus?
Exactly as he said in the press earlier, is that democracies are really going to be responsible for getting us out of this global pandemic. So as we see with the AstraZeneca that has been donated to countries such as Mexico and Canada, we are seeing that this is going to be very important from a global health perspective. Now, going over to India and how we're seeing variants, we now know that because how this virus has spread specifically in India, we're now seeing that the numbers are significant, with the country now having 50% of COVID infections globally and 30% of the deaths. Now, this also has to do with not having vaccination distribution, not having enough vaccines, and also still having a large amount of people, which again, with a virus that is very high transmittable in instances, we're going to see that these numbers may get worse before they get better.
Well, a new variant from India is rapidly spreading abroad. Where are we seeing these outbreaks, and how effective are vaccines against this particular variant?
Now, studies have shown, particularly with variants that showed up even as early as late last year in 2020, that the vaccine still had great efficacy when we're seeing numbers declining in COVID cases. So we're starting to see some of these variants in the UK and in Ireland. So as you can see, that we expected, again, with this typical COVID virus, that you will see significant spread. Now, the most important part about this is that we know that this variant is there, getting the people vaccinated, and also taking the precautions of lockdowns and making sure that anything that we can do to decrease spread is done immediately and effectively.
All right, Dr. Jessica Shepard, always good to have your insight. Thank you.
Thank you.